for our quarterly Veterans Town Hall. We do one here each quarter at the VA, so thanks for coming out. Today's town hall is in partnership with our Veterans Community Engagement Board, and they are doing an employment boot camp. So from now till about 6 o'clock, there are various classes that they are doing, everything from resumes to federal applications, social media, how to navigate a career fair, all kinds of great things that are going on. So we appreciate having that partnership with our Veterans Community Engagement Board and trying to bring a themed event like that every quarter. One thing we do here a little differently, if this is the first time you've been to a VA town hall with our healthcare system in recent memory, we do what is called a moderated town hall. So we will open up with some updates. We have Miss Peggy Kearns, who is the director of the VA Southern Nevada Healthcare System, and Miss Christina Tallarico, who is our acting service center manager here in Las Vegas for the Veterans Benefits Administration. So what they will do is they will provide you some updates on what's going on with healthcare and benefits here within Southern Nevada. And then from that, we do what is called a moderated town hall. When you came in, there was a comment card box out in the front area that you could fill out and ask your questions and that. And we have a couple people here in the room. Hey. All right, thanks. So we have comment cards. So we have a couple people here, John Scott in the back, as well as Mr. Dave Martinez. They'll bring you a comment card if you have a question of general interest. We ask you to fill out the comment card because we do a moderated town hall here, and we do that for two reasons. One is so that we can keep the pace going and answer as many questions as possible. We try to get it on a comment card. And two, we try to safeguard if it's personal nature or patient privacy, we try to get you one-on-one with a representative or take care of that if we have to do that here today with a representative or afterwards. We have your contact information so we can do that. So if you're interested in asking a question, like I said, the gentleman, John Scott, is in the back. Just raise your hand. They'll bring you a card and then we'll take a look at it. If it's a question of a general nature, we will do our best to address that here today. So I want to introduce a few other people that are in the room with us today. I would like to introduce from our congressional delegation, Miss Alana Simpson. And Miss Alana Simpson is with the office of Senator Cortez Masto. And I don't think we have any of our other congressional reps here as of right now. I'd also like to introduce in the back is Miss Nina Ridgway. And Nina is the chair of our Southern Nevada Veterans Community Engagement Board, which is our partner for these town hall events that we're doing. So thanks for being here, Nina. And then I'd also like to introduce the members of our executive team from the VA healthcare system here in Southern Nevada that aren't up here today. We have Miss Tracy Scala, who is our associate director. Dr. Jennifer Strawn, who is our nurse executive and associate director for patient care services. Hope I get that right. Dr. Alex Asani is our acting deputy chief of staff. And Mr. John Stessel is our assistant director. So thank you for joining us today as well. All right. So I think that's all I had for opening comments and protocol and all that. So I'm going to turn over to Ms. Kearns to give her opening remarks.
Good afternoon, everyone. I really want to thank Nina again and the whole Community Veteran Engagement Board for the program they're putting on today. This is a wonderful opportunity for veterans to get help with how to best present themselves for a job. So if you have time afterwards and you want to go to one of the classes, please avail yourself of that because Tony Giddens from Work for Warriors has worked really hard at bringing all this together for everyone. So, and I know we've got several people in a couple of the classrooms, so we're excited about that. Every quarter we do a town hall and an event with our Community Engagement Board. So the next one is October, and it's going to be transition, I believe, right? No, I'm sorry, women's health. And we always do a health fair every year with them, and we do an employment activity. So this is our employment activity for this year because there is a job fair July 31st at the Westgate for veterans. So, and that's sponsored by Work for Warriors. So this is kind of a prep, and then there's the job fair with actual jobs available on the 31st. So if you're interested in that, let us know. We can give you a flyer on when that's going to happen. So what I wanted to go over today is just some things that have happened since our last town hall. And one of the things that happened is in June, the Mission Act was passed by Congress. And the Mission Act for VHA, so Veterans Health, covers many different aspects, but the biggest aspect it covers is our VA Care in the Community program. Right now, for care in the community, we have 8 different ways that you can get care in the community. This act combines it into one funding source, and one way to do it. So we're really looking forward to that. Congress has given VA a year to put this program up. Unlike Choice, which was another program that Congress did for veterans, we had 90 days to put that one up. So it was a lot of trial and error. This time, the difference will be that we won't have an intermediary making your appointments. We will hire a company to build a network of physicians for us. So much like Blue Cross or Aetna or any of those kind of companies who have their own network of doctors, we will be creating a network of physicians and specialists for the Las Vegas area. And we're excited about that because we'll have a little more control over quality and how business is done and exchanging records back and forth. So we're really looking forward to that coming up. The Mission Act also expands the eligibility for comprehensive assistance for family caregivers. So what it does, right now, that program is only available to post 9/11 veterans. This will make it available for anybody Vietnam and back. So this is a big change for that. They anticipate about 150,000 more veterans nationwide will qualify for caregiver support. It also, it also looks at the VA's infrastructure. So VA has, well, the number, I always get different numbers, but about 140 hospitals across the United States. Some of them are old, more than 60 years old. And so they're looking at buildings that we can close on campus that aren't being used or those kind of things. So that mainly affects the East Coast, some in the Midwest. But for Las Vegas, we have a brand new, beautiful hospital. It doesn't affect us at all what is in that act. And finally, the big thing that we're excited about is a VA's ability to recruit and retain quality healthcare professionals. They have expanded what we can offer to providers, specifically physicians, psychologists, psychiatrists, as far as paying back their medical school. Money towards paying back. You may or may not know this, but the average debt that a medical student comes out of medical school with is $300,000 plus, depending on where they went to school. So many organizations now are hiring physicians and paying off their debt for service, so for so many years of service. VA has a program with that, but it can't compete with the rest of the country. We can give up to about 120,000. It's now been increased to 200,000. So that's a start, and we're excited about that part coming for us. So that's mainly what the Mission Act. You can look it up online if you want more and more details, because the whole act is out there and you can read that. I wanted to encourage all of you to get one of the newsletters that we have. There's a lot of great information in here. It's called VA to the Point, information on different programs that we have, and this comes out quarterly also. We always put this on our Facebook page. We put it on our web page, so you can get it electronically also. And then, how many of you have gotten a text for your appointment? Anybody gotten a text? There's a couple. Yes, that just started in May. It's called Vet Text, and the idea behind that is to remind people of their appointments. Just like I go to the dentist, I get a reminder that I have an appointment by text. It's also hopefully to decrease our no-shows. So we have about 11% of our appointments are no-shows every day. We want to decrease that. We want to make sure people come for their appointments, or if they're not going to come, we can offer it to somebody else. So that's the idea behind texting ahead of time. And then the last bit of information for you is the bridge closure that's going to happen Monday. The Pecos Bridge out here will close while they redo it to be part of 215, just like they've done all the other bridges. The bridge will be closed for 4 months, and the total project is about a year. So we will be kind of hemmed in for a while here. So we're encouraging veterans to come early, just in case, because there's going to be traffic coming from other directions. And I'm still wondering how we're all going to get out of here on Monday afternoon with the traffic, with the bridge closed, but we'll all figure it out eventually. So, but it's a good thing when it's all done. It'll look just like any other off ramp, no light anymore. So progress takes its time. After they do the Pecos Bridge, they'll go do the Losi Road, and then they'll go do Land. So this area is going to be kind of in construction for a number of years for that.
Christina, why don't you go ahead and give us your VBA update?
Good afternoon. As Chuck said, my name is Christina Tallarico, and I'm the Acting Service Center Manager covering both Reno and Las Vegas benefits locations. So an exciting piece of information about claims processing. The VA processed its millionth claim in the month of June, which is about 2 months sooner on average each fiscal year. So that's an exciting milestone for the benefits division. Currently, we have about 350,000 rating claims pending, and 22% of those are backlog claims, which would be 125 days and older. We've worked very hard in reducing the backlog and processing claims in less. Our goal this year is to process them in less than 125 days, and on average, we're processing them in 93 days. So we're meeting that goal, and we strive to process them more quickly every year. Another piece of information, dependency non-rating claims is what we would call them. We have an inventory of 432,000. That's a lot, but it's actually down 85,000 from last year. This year, VBA stood up 12 locations across the country, and they are solely dedicated to processing non-rating claims. So we're making large strides in reducing that inventory. Another significant Another significant, implementation is the passing of the it's basically the Appeals Modernization Act of 2017. It becomes effective in February of 2019. I'm sorry. So the Appeals Modernization Act of 2017, it streamlines the appeals process, and it establishes 3 processing lanes. We have 10 sites across the country who are processing these claims, and on average, they're processing them in 77 days, which for an appeals claim is, that's like light years. And as of the end of June, we've paid out $28 million in benefits for appeals claims. So basically what we are doing is mass mailing letters to veterans who have appeals pending in the old, what we would consider the legacy program, and you can opt into this program. It's been very beneficial, and the claims are moving much faster. An exciting piece of information, if you're participating in Voc Rehab or the Voc Rehabilitational Program here in Las Vegas, is we have been approved to hire 5 additional Voc Rehab specialist counselors. That's in an effort to reduce the existing counselors' workload so that they can assist veterans more quickly. So I think we have open vacancies now, and we're actively recruiting for those positions. That's exciting for Voc Rehab. That's really all I have.
Oh, well, that's enough. That's lots of great stuff. So thanks, Christina. We appreciate it. We appreciate you being here. I know that this is kind of a temporary assignment for you, so it seems like you've gotten yourself well versed on the issue. So thank you. So now we'll kind of move into our moderated town hall format. But before I do that, let me do a couple of things. I want to introduce Mr. Hunter Kane just came in. He is with Congresswoman Dina Tias. Hunter, thanks for joining us. And then I don't know if our executive leadership were any other updates that we had that, okay. Sure, throw it out there, get it all on the record. All right, so now we'll move into our moderated town hall format. And as I explained, we've changed our format here. So if you haven't been to one of our town halls in a while, this is a moderated town hall. So if you have a question, raise your hand and Mr. Dave Martinez or Mr. John Scott will bring you a comment card and you will fill that out and they will assist you with that. So John, please bring the card here. Sir, we're bringing you a card. So if Sir, this is going to give you. He's going to give you a card, and if you've got a question of general interest, we will ask it here today as part of a town hall. Sir, we're going to take your question right now. So if you have one, we'll take it and we'll try and answer it for you today. All right. So if anybody else has any questions, we have Mr. Scott or Mr. Martinez can bring you a card. So for those who did fill out their cards before the session here, I do thank you for that. And we're going to start getting to some of your questions. So the first question, and I think this is more of a VHA question, is the question is, will you post all VA job openings on your website? Only high-level jobs are listed at the moment. So now, I think that's if they're asking about our local website, our local VA Las Vegas website, or USA Jobs. Is that okay? So for our local Las Vegas website, so we are working with our HR people right now. I can answer this one. We are working with them to figure out a way to get more of our jobs like on our Facebook page and on our website. So we're trying to figure out what we can do to list those Las Vegas jobs. But if you go to USA Jobs and you put VA Southern Nevada or VA Southern Nevada Healthcare System in there,
Las Vegas.
or Las Vegas in the search, it'll give you every job that is available here at our facility, everything from low-level jobs to the doctor's jobs that we're recruiting for. So, but we will take that and address that up. So thank you. All right, so that question is answered. And then you have any other questions with that, please just, we have that VHA Las Vegas email address that or VHA LASPAO address. If you want to send us a question, we can actually get you in touch with our HR people too to figure out a way to get those as well. Okay, so this one is another question, and I think it's a two-part question. And I think part two is really our question, but part one might be one for the community, but I think we'll at least ask it. Part one was, what is the status of the proposed construction of the University Medical School near the Las Vegas campus?
Well, the decision for the Las Vegas Medical School is being built down by UMC. So it's not going to be built out here.
Right. But I do think that they have talked about doing some things out here in the future. It may not be the medical school, but they still, as part of their master plan, they haven't taken a school, some education off.
Well, what we do know is the 150 acres that are west of us was purchased by the city of North Las Vegas to eventually build a medical research park. I don't know of any more plans beyond that, but they purchased that land. When we do know, down towards Revere Street, they're going to be building, I think it's 900 houses out there. So this area is really going to be a growing area for the city of North Las Vegas, especially. But the medical school has already made the decision to build down by UMC.
Thanks. And this is the part two, and I think this is why the question about the medical school, and I know this is one we talk about all the time. What is being done to address the doctor shortage with the VA specifically here for Las Vegas? And I think medical school kind of hits the nail on the head.
Well, that is one of the strategies, is to get a mature medical school so that we can attract physicians and then attract them to the residencies that they'll create and then stay here as residents of Las Vegas. That's one of the hardest things here, is that we don't have a medical school. They just seated their second class a couple weeks ago. So it's going to take a number of years for that school to really get up and running and produce doctors and create more residencies and do that. In the meantime, we have a corporate recruiter that recruits physicians for us all the time. So he's looking across the country trying to attract physicians to come to Las Vegas, in addition to our own human resources, which does recruiting also for physicians. And we also rely on word of mouth and other physicians and providers recruiting other providers. And you'd be surprised that happens more often than it does from an actual recruiter. Is somebody saying, "Hey, I work here, and this is a great place to work, and why don't you come here too?" So if you know somebody that might be interested, let us know. We'll put a contact out there. But we are in a huge system. The VA is a big system, and people move about quite a bit from VA to VA parts of the country. So we're always looking to attract people from different areas because we think this is a great city to live in, and we have a beautiful facility, and we're new, so we have a lot of opportunities to grow here.
Great. And I think just to kind of top that a little bit too, I think some of the unique things we're doing is we have quite a bit of expansion of using telehealth services too. And we're working with some of our partners in Long Beach and San Francisco and other areas to actually bring the private providers to us virtually, some of our places, especially our rural communities. So I think you touched upon it too in the Mission Act stuff that they're actually expanding it's what is $300,000 to $500,000 to become a doctor nowadays, and they're expanding some of the monies that are available for that as well. So, and then the other thing we fight with here too is we're 47th in the nation per capita for physicians, as state is. So it's an uphill challenge, but I think we're moving in the right direction.
I think we are too. This is not an unusual thing for any of the hospitals in town to try to attract physicians. In fact, the new medical school's even struggling to attract physicians for the medical school. So as we get down the line, I think healthcare will improve in the city as we get more physicians to stay here and build new programs and make progress that way. But we're constantly recruiting for all kinds of doctors, aren't we, Dr. Sonny? Yes, all the time.
Great, thanks. All right, Tina, I've got one for you. This is one that's come up over the past 6 months or so. And I think a lot of this came out of an article that came out, I think it was a Washington Post or something like that. And this is around the November timeframe. There was an article where former Secretary Shulkin kind of stated that the VA was considering granting presumptive status for additional medical conditions for Vietnam veterans who were exposed to Agent Orange. Have you heard any updates on that within the VA or VBA side?
So I haven't heard anything about additional medical conditions, but I do know that they're actively looking into expanding to blue water veterans, so Navy veterans who weren't in the channels and the rivers of Vietnam or boots on ground, but the folks who were on board the big, the carriers that stayed out to sea that supported all of those operations. So we're hearing blue water veterans are the next big cadre of folks that we'll be able to take a look at.
Okay, great. And then kind of a follow on too is we've talked about this in our town halls before, is that the VA has expanded, is doing more for the Camp Lejeune veterans now. And I know that there's a lot of news out there about other things that are being looked at, but right now we're pretty much still with Camp Lejeune as far as the bases with water, right?
All contaminated water at the moment that we're addressing is centralized to Camp Lejeune exposure. But that doesn't mean that we're not looking at other areas. A lot of times it requires a lot of evidence for us to take a look at that. But for now, it's just Camp Lejeune.
Okay, outstanding. And then I'm going to ask you one more question here, and then I've got a couple more healthcare questions. And we've been asking this one for a while now. Decision-ready claims. We ask every town hall how many Nevada has, if we've gotten one, and I believe we did. We did finally get to one at some point. Can you kind of talk a little about decision-ready claims and where we're at?
So Nevada has processed one decision-ready claim. Decision-ready claims are essentially claims that are ready to be rated when the benefits package is submitted. So oftentimes when you're already service-connected and you're seeking increase, so you would fill out your application, submit a disability benefits questionnaire, which is essentially the medical piece of the evaluation. You would submit it to the VA. And we would process your claim, and we're able to do it. I can give you some statistics. For the one claim we processed in Reno, It was completed in 10 days, and the national average is 12 days. So across the country, we're completing those types of claims in 12 days, but we processed the Reno claim in 10 days. I have, and I can tell you, for widows benefits, DIC and pension, those are being processed within 10 days. That's if you can work with your power of attorneys or the VSOs to submit those claims. That's really the way to go for that.
Great. Thanks, Tina. So, Ms. Kearns, one thing we didn't talk about, and it might feed into this next question here, is the question is kind of, can you talk a little bit about the primary care clinic expansion that we might be doing here?
Well, we continue to grow here at VA Southern Nevada Healthcare System. We're growing at about 4% every year. But over the last 5 years, we've grown about 32%. So that's all good, but where do we put people? And we have trouble finding physicians, and we are running out of space at our clinics. So Southeast, Southwest, Northeast, Northwest are pretty full. So we have been approved to design and build a building here on campus for primary care. This facility was not built with primary care here. It was built as a hospital and specialty care. And all the primary care is out in the 4 big primary care clinics. And so now we've just grown so much that we need to add another building. It'll be, Brian, 10,000 square feet, and it'll service another 10,000 veterans probably in that space. So we're excited to have that coming up. We've also, on our plans, not approved yet, have asked for a new physical therapy building, specifically for physical therapy, because we do a lot of that. So that's going to come up probably in the next year or so for, hopefully, for approval to add that. So we're fortunate here at this VA, we have land, so we can add buildings. I've worked at 6 other VAs, and they're all landlocked, and there was nowhere to build anything. So we're really lucky here to be able to do that expansion. And we know that this area just continues to boom and grow. So as it grows, more veterans move here. And that's kind of exciting, though, that we get to do those kinds of projects and continue to grow our facility.
And that kind of feeds in this question here too. Is the question was when will a women's clinic separate from the hospital be built? Is there a plan?
There's no plan to change the women's clinic to a separate building. They have their own separate area. It's quite spacious and nice. What we need to find is some more gynecologists and those kind of doctors that we can even expand that clinic more.
Okay. And then there's a couple more questions. Obviously, then these are women's health related. It says that our women's veterans group has been moved from the clinic break room to a windowless closet that violates ADA and fire codes. Can something be done about that? I guess we could talk to women's health, and
we'll have to talk about that. I don't have an answer.
And so we'll talk with the women's program about that. And then the other part was, I guess there is also concerns with the women's clinic about non-clinic staff males wandering in that area. My understanding is that area is closed off to non-staff.
Well, there is a hallway in the back that people can walk through. A woman's clinic isn't necessarily closed to men all the time. So if we have women that have special needs, we take care of that by taking that out of there and not having men in there at that time. But there's no prohibition from having men in the women's clinic.
And this is kind of the final question. It just sounds like it says that I guess some of the women veterans kind of say we feel disenfranchised, devalued, and underserved. You know, I guess our women veterans aren't feeling like they're being taken care of. I think we do a good job of really trying to take care of our women veterans here. But I feel like if you feel like that is happening, please let us know so we can address that through the proper channels to make sure.
And our women veteran coordinator is out at one of the booths. We could arrange for that discussion to happen this afternoon.
Yeah. And like I said, we do a lot of women veterans focused events at this facility. We had a high tea event back in the March timeframe. We were working to have a women's veterans event in conjunction with our next Veterans Community Engagement Board event here. So we are working to do all we can to meet the needs of our women veterans. So hopefully we will change that that perception, and we do apologize. Okay, the next question I have, and I hope I get this right here, is, and I'm trying to read it here. It sounds like the question is, it just sounds like a general nature. We probably need more specific. It just says something about the services, providing the services. I don't know what that means, so we'll have to address that. Yes, sir. What's your question?
Well, okay. I think we need to talk to you on the side and find out what the issue is. Yeah. Yeah. Okay. All right. But no, I'm not. I want to get you the right person to help you answer your question. Okay.
All right, we will get somebody to talk to you one-on-one, sir.
Go ahead.
I said, we'll get somebody to talk with you one-on-one, sir.
All right. Well, we'll have Dr. Asani talk to you after we get done here. All right. All right.
All right, thank you, sir.
Thank you, sir.
And we will take that issue about transportation service and bring that up with this leadership. We'll take that for action, sir. Thank you, sir. All right. And Tina, I have one more question for you here today. And it's one we get at every town hall. So, and it's one I know that VBA can answer. So the question, it has to deal with rating percentages, and that kind of is, I call it VBA math or VA math. And that, can you kind of explain just briefly why a veteran cannot be more than 100% disabled?
Yeah, the VA math. So the way that I was taught is essentially you are a whole 100%. And the way that the VA math is taught to us is if we were to say that you're 50% disabled, let's just say for your heart, then what you have left is 50%. So then when we assign a percentage from that, the 20% is the 20% of the 50% that's left. And it just, this is not, I'm not doing a very good job. This is actually a really hard one to explain. Yeah. Thank you. That was very eloquent.
A great
I
explanation.
might have to have you write that down.
You're gonna have to.
I was kind of getting there.
That's good. Oh, that's great. I have to have you come do a session for us. So, thank you, sir. All right. So those were the questions that we had today that were submitted. I don't know if Ms. Kearns, do you want to say something else?
Thought of something else that I hadn't said in my remarks. Our building 5 first floor has been, our second floor is where we have physical therapy and our pain management program. The first floor right now is not inhabited, but it will be. We've been approved to add 20 more acute care beds because we need those beds. There'll be less people that we have to send to the community that we can keep here at the VA. We're going to add a 20-bed psychosocial rehabilitation treatment unit. Don't ask me to say that word again because it's like a mouthful, but it will be an outpatient residential treatment program that will focus on general mental health, PTSD, and substance abuse. So it's a program that you come into, you stay for about 3 weeks in general, and you get intensive therapy during that 3 weeks, rather than a lot of times we have a 20-bed locked psychiatric ward. Sometimes people don't need that, but that's all we have. So this is another opportunity to get intensive mental health treatment. So we're excited about that. And the other 20 beds will be 20 beds of community living center, some hospice, and some palliative care. So we're going to do this in a stepped fashion because we don't have all the money we need to do it all at once. So we'll open the 20 beds of acute care first because that's our biggest need right now, then the PRRTP, and last the CLC beds. And I anticipate that'll happen over a 2+ year period. But the first thing is we need general medicine beds because, well, when we get into January and February and the flu comes, we need the beds. Yes, Jennifer.
So you may see some green boxes with daisies on them and think, what in the world is the VA doing? Well, what we've done is we've implemented a recognition program for our nurses. And if you go to the private sector, you will see the DAISY Awards. And this is an international award that is given to nurses who demonstrate compassion and caring. And we gave out last week 3 DAISY Awards to our registered nurses. And they came from, we actually had one of the patients that nominated one of the nurses who came and presented the award to her. So DAISY stands for Diseases Attacking the Immune System. And this was a young man who had been diagnosed with an autoimmune disorder, and he subsequently died. And his family wanted to do something in recognition of his life. And as they were sitting around talking about the interactions in the hospital, they realized that it was the nursing staff that really demonstrated the compassion and caring. And so they created this DAISY Award. So we ask for you to take an opportunity to recognize your nurses that care for you. And you can do that and submit it. There are the green boxes with the little pamphlet on the side, and you can submit that, and we'll put it into the others that we have. And then we have an independent committee that looks through them and gives those awards out. So we please ask that you participate. Thank you.
Thanks, Dr. Strong. And that is a great program. And that kind of just segues into something else as far as giving comments about staff. If you're getting good care or if we aren't doing so well, you don't have to wait to come to a town hall to do that. Our Veterans Experience Service has done a great job of putting comment cards throughout our facilities. So you'll see comment card boxes there if you want to fill it out to thank a person for doing a great job, or if we need to improve somewhere, or you have a suggestion on how we can provide better care and services. Those comment boxes are throughout the facility. And then we also have the Red Coat ambassadors that we've talked about, the gentlemen and ladies who walk around with the red vests on throughout the facility to help veterans either get directions to an appointment or information on the VA. They also have comment cards, and they'll be happy to take those from you as well. And then I wanted to talk about one of the things we took from one of your suggestions here at the previous town hall, that it took us a little time, but thanks to our engineer service, contracting, and others, is if you've follow our Facebook page recently, we posted up over the last week, but we now have expanded our valet parking here at the facility. We used to just have it here at the northwest entrance. We now have it over at Building 5 during regular business hours for mental health and the pain management clinic side. And we also have it at our emergency room during regular business hours. So we have been listening to your suggestions and doing what we can to try and implement those as well. So, Christina, do you have anything else? All right. Well, I think that's all we have for you for today for the town hall. But I would encourage you that if you brought your resume today and you want somebody to look at it, they'll be happy to do that right outside this door. And then the list of classes that we're doing for the employment boot camp are listed up on the electronic bulletin board out there as well. So if you want to attend one of those, you have until 6 p.m. this evening to maybe attend one of those sessions. So we do thank you for coming. And our next town hall will be in October. And once we set the date, we will get that out to everyone. So thank you so much and have a great day.